let's talk about the face, because I think the face is a big one. Like you said, you were just doing facelifts nonstop, but there's other options now, right?
Yeah, and I think it's, the way I look at it, it's like you're building a house. And I get patients who come in to see me, money in hand, saying, I want a facelift. And I take one look at their skin, and it's like, I can tell that they haven't taken care of their skin in 60 years.
Yeah.
So it really is like, jumping to surgery is like you're building a house and you're so focused on what the attic is going to look like. Well, that's the last thing to consider. The first thing is you want to build the foundation, and the foundation of a house is going to be the food that you're eating, is what you put into your body, is your environment, is how much sleep you get. And that really is the foundation. And then the next floor may be skincare. Skincare is so important. There's so many of us who, either they're not doing anything for their skin, or they're slathering their skin in products that may not be good for their skin. And then from there are non-invasive treatments that we can do in the office, things like IPL and lasers. Then you can go from there up to injections, and then surgery being just that last little bit at the top where nothing else is getting you where you need to be. Then look at that as a possibility.
Yeah. And I think you're going to have such a better outcome. I mean, I just used to cringe when I would have patients with uncontrolled diabetes or who smoked, just thinking of how their skin was not going to come together well. It wasn't going to heal. They were going to, be in wound packing and all of that bit. Like, it really does matter the health of your insides, right?
Yeah, and what we're finding now is that there are studies coming out showing that the foods that you eat can really make profound impacts on the appearance of your skin. And it comes down to things like the microbiome, and there are connections between the microbiome and inflammatory skin disorders, things like rosacea and eczema. We're finding that taking certain types of supplements, vitamin C supplements, collagen supplements, that can really impact the skin and how hydrated your skin is, how many wrinkles you have. So really what we're finding is that kind of that traditional belief, the traditional stuff that we learned when you and I were residents, that you don't smoke, you wear sunblock, or you stay out of the sun. And then otherwise you have surgery. Like, there's so much more. And essentially that's the crazy thing. I went through 5 years of residency, a year of fellowship out in Beverly Hills, and we didn't cover nutrition at all,
Nope.
and you and I know when we're in the hospital, we're working late in the middle of the night, and 2 a.m., the cafeteria opens up for us residents who are there overnight. And what is it? It's fry bar. It's everything deep fried. And, we get our plates and stuff that stuff on our plates, not even thinking how bad that was for us.
Oh, yeah. We called it fourth meal. And I lived on donuts and garbage. Oh my gosh, the garbage. I mean, the nurse's station always had huge bags of M&Ms. It was always somebody's birthday. There's cakes everywhere. Like, it's the unhealthiest situation you can imagine.
It really is. And nowadays, when you've got fast food restaurants that are in hospitals,
Oh,
I mean, it's, unfortunately, medicine has gone in a direction that is essentially, people are getting unhealthy, and you treat them to try to treat their acute problem, but you're not necessarily helping them to not come back again. And so we see that even with plastic surgery. It's like people will come in and they have money, they want their facelift. Well, there's so much else that you can do. And even if you have that facelift done, getting on the right diet, using the right skincare, you can enhance the results of your facelift. You can prevent the need for a second one potentially, and you can potentially heal much better and heal faster if you do have surgery.
yeah, exactly. So I love the idea of getting on a good skincare regimen, often, skin probiotics, that type of thing, hyaluronic acid.